Mistake that a lot of people out there do when they're getting onto Medicare or they're currently on Medicare. We have Alyssa from Chapter Medicare. It's my partner that helps you all with all things Medicare. And I say that we've got kind of a dream team happening here. Um, we've got I use my experience. I ran the third busiest Social Security office in the country, and I help y'all with all things Social Security, retirement, spouse benefits, survivor benefits, disability. And this is also a live Q&A. So if you have any questions, make sure you start typing them in the chat down there, and we'll get to as many as possible. This will be an hour broadcast like normal. If you're watching this later on a recording, you don't have to watch the entire hour. The last 45 minutes or so, 40 minutes will be a live Q&A, just answering people's questions. But what we put together here, it seems like it's a dream team. We've got the three musketeers, the three amigos. It's basically I'm helping you all with all things Social Security, making sure you're getting everything there. Thomas from Chapter Medicare, which we've invited him in. He's gracious to come in a few times and answer y'all's questions on all things Medicare, applying for Medicare Advantage and Part D and Medicare supplements, N and G and all the rest of it. But that's not the end of it. We're trying to provide a full service here. We get you from, all the way from the beginning to the end. And getting your Social Security check, getting your money is perfect. Great. We want to do that. We want to get you signed up in the best Medicare plan for you. Great. Thomas and his team helps with that. But what happens when you actually sign up for a Medicare Advantage, a Part D, or a Medicare supplement plan? The ongoing service. And that's the reason, one of the big reasons I chose to partner with Chapter Medicare is because they have a member success. That's what you all call it, a member success team, right?
Yeah, that is right, Ed, our member success team. And the member success team, the people on that team, we call them member advocates, which I think is the perfect description of what they do. They are there advocating for our members every day, making sure they get what they need while they navigate Medicare.
Perfect, perfect. So Alyssa is the member success lead of Chapter Medicare, and we're going to talk about what type of services her and her team provides. Like I said, so we've got you covered on all bases. And I think there's another three that I wasn't going to, I like the three amigos. I like the three musketeers. I like the dream team. There's another, the Three Stooges, but yeah, that's after hours with our families, and I guess our
Yeah,
dog's there in the background, right?
yeah, and the dog in the background. We all embody those three phases at different points in time, for sure.
Exactly. There we go. There we go. Yeah, I've got a cat in the background, and since we're remote, they won't attack each other. So I think we're good.
There we go. That works.
All right. All right. So let's see here. We've got, let's go down. We're going to go to the four issues that people have and they need help, navigating the bureaucracy and making sure they're getting everything from Medicare. Because a lot of people don't realize, they get these Medicare Advantage plans and a lot of them are zero premium. And they're like, wow, this company is giving me something for free. This is awesome. Actually, it's not free. It's zero premium. It's a pay-as-you-go system. You might have to pay for the doctor, a specialist, CT scan, an MRI, a night in a hospital. But I hate to break the news to you. These companies are for-profit institutions and they're in it for a profit. And how do they make their money? Well, you paid them when you worked all those decades and paid in a FICA. FICA includes Social Security and Medicare. So all of that money you paid into Medicare, all those decades, that's what goes to the Medicare Advantage plan and the prescription drug plan. So these are all benefits you paid for. So it's incumbent upon you to make sure you get those benefits, but it's difficult, very, very difficult. And that's why it's always good to have a team on your side. And that's why we've got Alyssa here today. So the first one is the biggest one. So when Thomas and his team, if you call them up and say, hey, I'm turning 65, I'm new to Medicare, or I want to switch my plan because there's close to 2 million people having their plans canceled this year, and I need to find a new plan. The first thing Thomas and his team does is, hey, who do you want to continue seeing next year? Which hospitals, which doctors, which clinics? And then, let's start off with that. The first question, how do you all help once they have a plan? How do you help them find doctors?
Yeah, it's a really great question. So, one thing that you said, Ed, was, Thomas and team, they do such a great job making sure that if there's doctors that you want to see, that you can continue to see those doctors on the plan that they sign you up for. Um, such a good job at that. But the reality is that things change over time, right? Maybe you move or you have different healthcare needs, you need to see different health professionals. And at that point, you're thinking, oh my gosh, I need to find someone. How do I go about doing this? What should I be paying attention to? Where do I even begin? Um, my philosophy is, I want chapter members to spend as little time and, not be anxious about getting the healthcare that they need, right? Because that's just one less thing that we
Mm.
need to be anxious about in life. So our member advocate team can really help you find exactly what doctors, facilities, clinics are in network in your given Medicare Advantage plan. They can also help you narrow down um, what doctors you might actually want to see, right? There might be lots and lots of doctors in that network that you can go see, but they might not all fit your needs, right? So we can talk about things like what you're most comfortable with. Would you prefer to see a female doctor or a male doctor? Sometimes that can be really important, giving the sensitivity of what you have going on. We can talk you through some of those things that you want to think about when you're choosing a healthcare professional or finding a new clinic, and then narrow down your choices. We'll give you a curated list of folks that we think fit your needs, and then we're here to help you make sure that you get that appointment, and that after the appointment that you're successful in that.
Perfect, perfect. So the difference between the HMO and the PPOs, could you speak to that a little bit?
Yeah, absolutely. So in Medicare Advantage plans, the type of plan that you have really dictates how you're going to go about seeing doctors. In some of those plans, you're actually going to have a primary care physician that you have on file, and you talk to about all of your healthcare needs, and then refers you out to a specialist. In other scenarios, you actually don't have to go through that process. You have a little bit more freedom and flexibility in terms of what doctors you can see and who you need to get authorized from in order to go about making those appointments.
Perfect, perfect. Yeah, and then a lot of those, again, yeah, Thomas, once you sign up for the new plan, they check to make sure, the doctors you want to go to are in the specific plan. What a lot of
Yeah,
people make mistakes on is they, try to do it themselves, but they don't know all of the
yeah,
kind of the tricky situations. So they say, "Hey, I'm interested in signing up for Medicare Advantage XYZ in my particular area, and so this looks good. It's got, it's zero premium and it's got gym membership and, whatever the case may be. Let me see if, the doctor I like covers it." And they call the doctor's office and say, "Hey,
hmm,
do y'all take Medicare Advantage XYZ?" And the company and the doctor's office says, "Sure, we take it." What they don't realize often is Medicare Advantage XYZ company has 2, 3, 4, 5, 6, 7 different plans, and
yeah.
they might not take the specific plan. They may take that company, but that particular plan they don't take. You see that happening, unfortunately, way, way too many times.
Yeah, we do. And one thing that I think is incredibly important for people to keep in mind when it comes to Medicare, but also lots of other things in life, is specificity matters, right? When you're talking about your healthcare needs, when you're talking about what you want out of your plan, being specific really matters. So sometimes calling up and saying, "Hey doc, do you take Humana?" just isn't quite enough. And that's one thing that I think we have done well at Chapter, is making sure that we're being very, very specific about the questions that we ask in support of our members.
Mm.
That way, you're getting the most accurate information and you're not running around in circles,
Right.
which unfortunately happens far too often.
Yeah. Yeah. And again, we're talking about Medicare Advantage with this, because remember, Medicare Supplement, the plan F, G, and N, as I always say, your network is America.
Yeah,
So
that's
any
more
doctor in
flexibility.
the country that takes Medicare will take your plan. And some people said, "Hey, I went to this doctor, Ed. You said any doctor will take my." Well, the doctor has to be accepting new patients as well. So yeah, so I always
Mhm.
have to qualify
Mhm.
it. If the doctor is taking new patients, they will take your plan. You don't have to ask them, "Hey, I've got Medicare Supplement Plan G with XYZ company." You don't have to ask them that. Do you take Medicare? Yes, I take Medicare. Okay, doesn't matter what company
Done.
you have.
Yeah.
You're done. Yeah.
Yeah.
So, all right. So, yeah, this is specifically the issue with doctors and HMOs and PPOs is specifically
Yeah.
related to Medicare Advantage. All right. Let's move
Yeah.
on to number two, prior authorizations.
Mhm.
So, do you want to go over a little bit of what prior authorizations and what type of issues that come up?
Yeah. I think the important thing to keep in mind is even if you talk to a very well qualified advisor at chapter or even frankly anywhere else, and they find a plan that fits your needs, that doesn't necessarily equate to it being like smooth sailing, that there's nothing that you're going to have to do after you actually enroll in that plan, right? There's still going to be um, situations along the way in which you have to put in a little bit of time and a little bit of effort. And hopefully that time and that effort is minimal. At least that's what we tried to do. Prior authorizations, I think, really do fall into this bucket. Based off of your health needs, based off of the prescriptions that you're taking, all of these different things, it could be that you actually have to go through a prior authorization process. Now, the worst thing to happen is to have to go through that process and be surprised by it. You go and you think you're all set, you're picking up your medication, you're going to see your doctor, whatever it is, and they say, actually, nope, you know what? We need to get, we need sign off for this, right? That is shocking and it's also uncomfortable because nobody likes surprises in their healthcare. It's something that we do see from time to time. So that's the first thing. Make sure that you're talking to someone who can really tell you exactly what you can expect when you sign up for that plan and hopefully actually help you get through those processes. Our member advocate team has spent a lot of time documenting and researching and calling and talking to all of these carriers and providers and saying, what does a prior authorization look like? How can we best navigate the situation for our member? So again, they're not overly anxious about this issue. So the specificity again really does matter, and you want to make sure that you aren't surprised about what might be required, even if you're on a really great plan.
Mm. And that's why I would argue that this we definitely put together a dream team. That it's the whole thing is just way too confusing. So again, if you need
So
help with all
confusing.
things
Yeah,
Social Security, finding a new plan every year, if that's what if you've got a Medicare Part D or a Medicare Advantage, and then you want
yeah,
help with all this, you just don't want to have to worry about it. It's way too much. Then
yeah,
you just call us up,
yeah,
and yeah, and we
yeah.
can help, right?
And yeah, exactly, and to the point, you might have been on a wonderful plan last year that fit every single one of your needs. You were so happy with it, and you have to keep in mind, on the Medicare Advantage side, these things can really change year to year. So that plan that you loved might not even be available to you next year. And if it is available to you next year, those benefits that were so important to you might look a lot different. So it's important to keep engaging with this information even after you find a plan that you really like.
Yeah, I equate it to like in terms of their their Medicare plan. Uh, they think they have a Corvette in the driveway. They
Yeah,
love it. It's nice and shiny. It's fast. It's awesome. And
yeah.
they wake up January 1st and someone has stole it and stuck a 1972 Pinto there. And guess
Yeah,
what? That's what you
yeah,
got. Or in this
yeah,
year, they completely stole it and there's nothing there because again, there's like 2 million people that are going to lose their plans. Up to 2 million people are going to lose their
yeah.
plans.
Oh,
And I
hard, yeah.
guarantee, yeah, this is going to be, I keep, people are, my regular viewers are probably tired of hearing this, but I know there's hundreds of thousands of people out there that got the letter that their plan has been canceled
Mhm,
or the post office didn't,
mhm.
deliver it to you and that they didn't open or they didn't get the letter or they thought it was just another form letter and they're not going to do anything. And then in January and February, when they go to the doctor, they're going to be shocked that the doctor says, okay, here's the bill. And they're like, well, I've got this. No, that expired December 31st. You have no other care. So please, if you got any friends or family, uncles and aunts and parents and grandparents that have Medicare Advantage, a Part D plan as well, same situation with Part D plans, please make sure they check. And even those that have not been canceled, there is many, many, many more that have been downgraded to such an extent that if you read the fine print, you would cancel the plan and look for another plan.
Yeah.
It's
Yeah.
it's not going to be good.
Yeah, and I will say, Ed, that's something that we're seeing on our side right now. We're reaching out to our current chapter members to make sure that they're set up really well for 2025. And something that we're seeing fairly often is people saying, "Oh, I love this plan. I don't want to change." And then when we look at what changes are actually happening in that plan, we go back to them and we say, "You know what? We really think that we need to talk about this because there's things that are changing. The things that you were so enjoying about that plan aren't going to exist in the same way anymore." So having a trusted person who can kind of help you do that due diligence can be really helpful too.
Yep, yep. Yeah, I've talked to some of the actual carriers, the health insurance companies. They have, again, multiple plans in particular areas, and they say they have some plans that they don't sell anymore. They don't enroll people in those
Mhm,
plans anymore. And the only reason they're keeping them on the books is they've got, a few dozen or maybe 100 or 200 people still in that plan, but are just so
mhm,
stubborn that they don't want to change anything. They're happy
mhm,
with it because they've never had to use it
mhm,
necessarily. And if they actually used it and, they say, wait a second, the same exact company with my same doctors, the same zero premium saves me so much money every year, but I'm kind of stubborn and I don't want to change. And I think that's part of that is the entire industry, the Medicare insurance agents and brokers and all the wild west that has happened. It's kind of
mhm.
it put a sour taste in people's mouth. All those
Yeah,
calls that you get 100 calls a day, wanting to switch you and stuff, and people just say, leave me alone, and they just stay where they are. And I can understand that, but
yeah.
it's going to hurt.
Yeah, yeah, there's definitely this balance. It's so hard this time of year. Again, members coming to us saying, I'm getting so many of these text messages. I'm getting so many of these calls. It's hard to know who to trust, and I
Yep.
certainly empathize with that for sure. But when it comes to your healthcare, be picky. Know what's going on there. Find the plan that's right for you.
Yep. Yeah. Again, you paid for it. You all
Yeah,
those decades you worked, you
exactly.
paid for every single thing you're getting. So that's your job in retirement. My retirement lasted about a week, and I'm back again here. But if you're actual in retirement, if you're doing it right, unlike me, and you're actually retired, then you do have a job, and your job is to make sure your Social Security check is correct. I can help with that, and your job is to make sure that you're in the right plan. Thomas and his team can help with that, and your job is to make sure that whatever company you pick treats you right. And Alyssa and her
Mhm.
team can help you with that. So.
Yeah, absolutely.
All right, number 3, over-the-counter dental, vision,
Mm,
hearing, gym, all those extra benefits you see advertised on TV that, yeah,
mhm.
sometimes they're actually correct, right?
Yeah, so sometimes they're actually correct, and I think, again, with Medicare Advantage plans, they often come with these very lovely benefits, and that should be part of the conversation when, if and when you're choosing a Medicare Advantage plan, what types of additional benefits are important to you. When I think about what people oftentimes most miss out in when it comes to these additional benefits, I think there's a couple of things that are important to address. The first one is if you have access to these benefits, please make sure you use them and that you understand how they work. I can't tell you how many times actually, I was listening to a call the other day that where a woman called in, and she had forgotten that she even had an over-the-counter benefit with her Medicare Advantage plan, and she had a pretty good benefit that where she could have been taking advantage on a monthly basis, making sure that she was getting those over-the-counter supplies that she needed, and she completely forgot about it. The way that she explained it was, I kind of remembered it, and then wasn't sure how to use it. It kind of just went out of my mind. And that happens so often, right? You want to make sure that you're using and you're taking advantage of those benefits that are offered to you. The other really important thing here, again, is the timing that's associated with them. Something like an over the counter benefit might be available to you on a monthly basis, on a quarterly basis, and it's like use it or lose it kind of scenario. So you want to make sure that you're making the most out of that,
So
whatever's
you
given
lose it
to you,
at
for sure.
so it depends on the particular company, a particular plan. You might lose that
Mhm.
$100, $200 over the counter benefit at the end of the month or every quarter, right?
Yeah, that's right. There's a lot of nuance here, right? It depends on your plan exactly how it will work. So you want to make sure that you understand that. But yes, absolutely, you want to use those benefits before you lose advantage of them for sure.
And next year, CMS, the Center for Medicare and Medicaid Services, has come out with a new regulation that these Medicare Advantage plans have to send you a letter mid-year that says, hey, you've got $2,000 of a dental, and we notice you haven't used that, and we just kind of let you
Hmm.
know that you have this $2,000 of the dental. And I think that's one of the issues that is driving up the chaos of
Yes.
2025 is all of these companies are saying, okay, we've enticed people with all these great shiny benefits and everything,
Hmm.
and they've signed up for our plan, but we're either making it kind of difficult or people forget about it or, whatever the case may be, and
Hmm.
people aren't using it. So we're making tons of money because we're getting paid by the government to offer these
Right.
extra benefits and people aren't using it. So we're making tons of money. And now with the help of Alyssa and her
Yeah.
team and that new letter that's going out, the mid-year, the companies are saying, "Oh my gosh, we're actually going to have to we're going to have to put our money where
Yeah.
our mouth is," and that's one
Hmm.
of the reasons they're cutting back benefits and canceling plans and all the rest of it. So this is a crazy year.
Yeah, absolutely right. It's certainly one of those things where it goes back to exactly what you said at the top of this conversation. It's a business, right? These are
Yep.
business companies. They are out to make a profit, and I don't want to vilify them for that certainly. But at the same time, they assume that there's people out there that they're going to entice with these benefits that won't actually use them. Chapter, my team, CMS with that letter is helping people get access to these plans, but that also, comes with a cost. There's a lot of changes that are happening within Medicare in 2025, and it's important to call that out. Again, going back to the fact that you want to
Right.
make sure that you definitely look at what's available to you.
Yeah. It's kind of like a gym membership, I guess, since we're coming up on New Year's resolutions
Yeah,
close and a gym membership. So they want you to go ahead and enroll for a year. And then you go there, what, January 3rd, January 5th, a couple of days, and
yeah,
then the rest of the year you just pay the monthly fee and they're
yeah.
happy, right? Yeah.
Right.
So
Yeah, yeah, yeah. They're excited. There's no wear or tear on the machines, but they're getting their money back.
exactly. Exactly. What are you seeing with the dental for next year? A lot of people want
Yeah.
very expensive dental work, and how do you kind of work that system? Are you seeing any issues?
Yeah, looking into next year, there's a lot of dental benefits that are getting pretty significantly cut. That's actually a large part of the conversations that we're having with our members today is around those dental services. So one of the things that we're talking with our members about today is if there's really important things going on that you need that dental coverage for, let's try to get it in before January. And then when your new
Yes.
plan starts, you can at least, start working on it, but don't delay those visits to the dentist if you need them. It's good to get started in 2024 and then move into 2025 feeling okay about that reduction if it exists for you.
Yeah, and a lot of dentists they know the situation where you've got $1,000 of dental left, and it
Mhm.
expires December 31st, and the doc says, but you need $2,000 worth. So they'll do like the lower part
Mhm.
December
Right.
31st, and then when you get the new money in January, they'll do the other
Yeah.
part, right? Yep.
Yeah, exactly. If you have a dentist or a doctor that's on your side, they should be helping you figure these things out. And if they're not, hopefully the member advocate team at chapter can help you too.
Perfect, perfect. All right. And then speaking of money, billing
Yeah.
issues and coding and all that kind of stuff where they deny it or they charge you because it was coded wrong. What type of issues are you seeing there?
Plenty. A lot of different issues when it comes to billing and coding. It's actually one of the most common scenarios that we help our members with. I can tell you a story that we just got this fixed for one of our members earlier this week and have been frankly celebrating as a team that we got this over the finish line because it was such a hairy issue. Billing and coding issues, it's one of those things where you feel like it really shouldn't be as complicated as it is. Someone fat fingers something or, it's just put in the wrong way. And unfortunately, that can cause a huge, huge headache. One of the things that we see happen very often with these billing and coding issues is no one wants to take responsibility for it, right?
Yep,
Everybody's
yep,
sort of like,
yep.
oh, not my problem.
All right.
The hospital saying not my problem, the carrier saying not my problem. And the person who's going through this is saying, well, like, who can help me with this? Because everybody's saying that it's not
It's not
them.
me. Yep.
Yeah, it's not me. It's not me. One of the things that we do most often with these billing and coding issues is hunt people down. I don't know, that sounds really negative. I shouldn't say it that way. But make sure that the people who are responsible for getting this fixed get it fixed and get it fixed as quickly as possible. Oftentimes what that means is actually telling um, a a doctor's office or even, sometimes the carrier in these scenarios, I need you to do this for me. And we'll tell them exactly what they need to do step by step
Wow.
to get
Wow.
it done for the member. There's
and and
cases where
and
we literally know this better than they do sometimes.
and this is their job and says, okay, yeah, open your
Yes.
computer,
Yeah.
put in your
Yeah.
password,
Exactly.
change
Exactly.
this
I
code to
need you to
this
go in
code.
there. That's right. That's right. That's right. It sounds so funny, but sometimes in order to get things done for our members, that's the approach that you have to take, right? You kind of have to grab the bull by the horns.
Yep. Actually, that's what I spend quite a bit of my time with helping everything with people with Social Security is I say, go to your local office and then tell them this and tell them to open up
Yeah,
MCS and check the
exactly this.
non-service months and
Yeah,
then your overpayment will, yeah. So yes, I do the same
yeah, you
thing.
got it.
So I'm gonna have to get a box of crayons around here sometime and say, okay, take these down.
Yeah, I love it. I
Yeah,
love it.
yeah. Anyway, all right. Let's so I've got the number for chapter Medicare. So if you need help with Medicare finding to make sure your doctor your plan is good. You want to switch from Medicare Advantage to a Medicare Supplement or Medicare Supplement to an Advantage. You want to check your Part D, whatever the case may be. Make sure you give them a call, and they help 100% for free. And then once you're a part of chapter, then Alyssa and her team is there available to help you out. And it looks as though, let's go ahead and jump into some of the questions here. Doris, I was just officially approved for Plan G. Thank you, Ben at Chapter, for making it easy. Okay, I like it. So yes,
Love
I've
that.
gotten
Shout out to Ben.
100% perfect response, but I think there's one I just kind of noticed that we'll talk about
Oh,
here. Another, is there a plan like Plan G, but I have AFib, sleep apnea, and neuropathy? What plans might accept that? So Medicare supplement plans it really depends on the particular company. So yeah, so in terms of Medicare supplements, there's Plan G, Plan N, Plan F, and it really depends on the particular company. If you're talking about, it sounds like Priscilla's maybe has a Medicare Advantage or something, and she's not in a special enrollment period or lives in a state that has, no health underwriting. Um, so it really depends on the particular company. Sometimes they will accept something like that, sometimes not. Sometimes they'll say, well, one company looks back 1 year or 2 years or 3 years or 5 years. But call Chapter Medicare and they can look exactly what's available in your particular area and see if they can find you a special situation where you can switch if you're looking to switch. Let's see. Can you please talk more about Social Security benefits as someone is retiring with minor children? Alyssa, I think I'll take this one.
Yeah, I'll leave that one to you, Ed.
All right. So yeah, if someone is retiring, even if you're receiving retirement benefits or disability benefits or whatever the case may be, and if you have minor children, absolutely. That's one of the questions. I've taken hundreds of thousands of retirement claims, disability claims, and that's one of the questions. Do you have any children under the age of 18 or that became disabled before the age of 22? You can tell I've asked that about a million times, right?
Mhm.
And if you have a child under the age of 18 or that became disabled before the age of 22, then if your benefits are going to start next month, then they will also take a claim for those children as well. And the children can receive up to 50% of your full benefit amount, at your full retirement age. There's a family max involved. If you have like 2, 3, 4, 5 kids, then there's only a maximum that they can pay out. So they'll take the maximum payout and they'll divide it by the 3 or 4 kids or whatever. But you can receive up to 50%. And I see a lot of people missing that when they file for disability, because they file for disability and it's denied and they go through the whole process and they don't get approved for like a year or two. And then somehow the children being added and starting benefits is kind of dropped, it's forgotten and people are losing money. So yes, if you have children, absolutely. Dr. Eck, I hope that's a typo. Your son Eddie emailed me. I wanted to make sure he is legit. Yes, my son is 100% legit. When he was younger, not so much, but he's legit now.
He's
Yes,
grown into it.
exactly. Yeah. So, what will happen to Social Security in 2025? Wow. I guess we shall see. But I'm going to keep an eye on everything because, Alyssa, I think you've seen this as well. Politicians, when they're running for office, they make promises. And,
Mhm.
I know a little bit about American history, and I know quite often those promises aren't fulfilled for whatever reasons. There's, changes, situations, there's other politics involved. And so I'm going to keep an eye on all of it. So there's any type of policies when it comes to Social Security, Medicare, Medicaid, retirement survivors and all that kind of stuff. I'm going to keep an eye on all of that for y'all. And that's my commitment in my semi-retirement, is to continue as long as I possibly can to make sure y'all get everything you're entitled to. So just stay tuned, I guess.
Mm.
Hit the like button on the way here. Yes. All right. Let's see. Okay, here's the one I noticed. Bill, Ed, I called your Medicare team and didn't feel I had any questions answered. Okay, that's not good. I wonder, Bill, if that's did you call chapter, or I was working with another team prior to that? Yeah, I've all 100% reviews perfect on chapter. So, Bill, give me an email. Email me at ed@mygovexpert.com. Actually, well, let me see if I have it up here. Oh, I don't think I have the number up there. Oh, okay, yeah, I don't have my email up there, but it's ed@mygovexpert.com. So email me, Bill, and tell me exactly what the issue is, and I'll reach out to Thomas or Alyssa or whoever the
Yeah.
particular case is, and we'll get that addressed. Thank you for letting me know. Perfect. Thank you, Bill. I appreciate it. Daisy, Dr. A, congratulations for all you do to prepare us. You're welcome. If we have paid into the system I like this question too. Renee says, great question. If we paid into the system our entire work lives, we're talking about Medicare, why do we have to pay $178, $174.70 or whatever it costs to Medicare? You want to try that one?
I'll let you take it, and then how about I'll add on to it.
Okay. I agree 100%. If, part A is, the Medicare tax, the FICA tax, that essentially funds part A of it. And that's one of the, with Social Security, they're looking at about 2034, 2035, then the trust fund is going to run out, and then only current people paying FICA will pay current people receiving that. And all estimates, the CBO and everybody estimates anywhere from a 17 to 20% cut of those benefits within the next few years if we don't do something. Medicare Part A, same type of situation. It's paid for by your FICA taxes all those years, and that's why it's zero premium for most people. Part B, how do we pay for Part B? It's not paid by your FICA taxes. It's paid by the monthly premium. So those FICA taxes actually paid for Part A, but Part B, it's kind of a pay-as-you-go type situation, and so that's where Part B comes in. You want to add anything to that?
I think it's a great explanation. And the other thing that I would just add again is, again, like you are paying for Medicare in so many different ways, right? Through your taxes, through there's premiums, all these different things. Again, why it's really important that you understand your coverage and that you make the most out of it. Otherwise, what are you paying for?
Exactly. So yeah, the zero premiums and all this kind of stuff, and the free gym membership, and the $2,000 to $3,000 of dental, the money comes from somewhere, and where does it come from? It comes
Yeah.
from taxpayers. So, and then there's the monthly premium for Part B. So that's unfortunately the system. I always say, if I was dictator for a day, the first thing I would do is cut out all the gaps of original Part A and Part B. So you wouldn't need a Medicare Advantage plan or a Medicare supplement or Part D plan. And then I would add vision, dental, and hearing in there, because how healthy you are in retirement if you can't see, eat, or hear, right? I don't see myself being a dictator for a day, because
You're
my first
you're very
priority would be the cure for male pattern baldness.
I was just saying, and you're a very benevolent dictator there with
Yes,
what you're looking to do.
enlightened. Yeah, but you were about to say that before I said my priority number one.
Of course.
Yes. So hey, I gotta get what's mine. The thing that really blew my mind is the fine for late enrollment. I wonder what is up with that. Yes, obviously, there's not a fine for Part A because it's free. It's not free. It's zero premium, right?
Mhm.
Part B, there is the penalty. If you don't sign up for Part B when you're supposed to, then you're penalized 10% for every 12 months for the rest of your life. Yes. But you also have to understand, because it is insurance, and insurance is a pooled risk. And the reason that they, make you sign up when they do is because you're like, well, I don't need it. People used to walk into the Social Security office all the time and says, why are you making me pay this? I don't use health insurance. I'm healthy. I didn't use it this year. Well, that's, same with car insurance. Why do I have to pay car insurance? I didn't have an accident this year. Well, somebody did, and that's where the premiums go to. So the same exact thing. I blame the Scottish. They're the ones that came up with the modern insurance system. So my
Yeah,
family's from
yeah,
Scotland, so I will blame them. Sorry.
that's fair. And it
Yeah,
and it and it is, when you a little bit when you think about it, if everyone was only paying for it when they needed it, you run into some big problems there.
exactly. Yeah, the day you have a car accident, you call them up and say,
Right.
Geico, I'd like to go ahead and sign up and give me like $1 million coverage, because they don't look good on the other side of the highway there. Oops.
Yeah.
Yeah, so yeah, that wouldn't be good. That company would go out immediately. You know what Geico stands for?
I don't, but now I wanna know.
Yeah, the Government Employees Insurance Company.
No, I did not know that.
Yeah, yeah, I've actually, when I was a young, it was usually just at the beginning. I think it was just for the government. I've had Geico since I was, young private in the Marine Corps. So anyway, side thing is, I'm a wealth of useless information. Oh, here's a good question. Pull out your calculator, Alyssa. How much does
Yeah,
this guest and her advocates charge to help me? How much do you charge?
it's a really great question. So, when you become a chapter member, and I should also add, becoming a chapter member is completely free. That means that you get to talk to one of our very, very experienced advisors who helps you find a plan that fits your needs. All of that comes at no cost to you. Even after that, all the additional supplemental support that our advocates use also comes at no charge to you. So, luckily, there is no cost associated here.
Perfect. And now's the time to secure that help. Call Thomas and his team, review your plan, see if they'll see if there's anything better for you, save you some money for next year, see if your plan has been canceled or downgraded or whatever the situation,
Mhm.
and Yep. And then Alyssa is available to you and her team 365 days of the year. Well,
That's right.
maybe not. Yeah, maybe not. Yeah, maybe not on the weekends.
A few less, but not not many.
Okay, all right. Those are the weekends we transition into the Three Stooges phase.
There you go. Exactly.
Right. Okay, let's see here. My daughter receives SSI and she recently qualified for survivor benefits. We were advised that this will affect her SSI. Is there any way we can keep both? It really depends. So SSI is supplemental security income. That's the welfare-based benefit that Social Security Administration administers. But when you receive SSI welfare, you have to apply for any other benefits you're entitled to, because SSI comes out of general taxation. So if the child is eligible for survivor benefits, they have to sign up for survivor benefits. And if you say, no, I don't want to sign up for survivor benefits, then your SSI will stop. So you can keep both though. If the survivor benefits are less than SSI. So if you're receiving, the max on SSI this year is $943. If the survivor benefits is $500, then you'll get survivor benefits plus another $443 from SSI. But survivor benefits are usually more than SSI. So probably what you're worried about is you're like, oh, can I keep SSI? And survivor benefits probably going to be more money. But I think what you're worrying about after doing this a million times is you are getting your Medicaid from the state because she's categorically eligible for Medicaid because she's on SSI. And if she loses SSI, she just might lose Medicaid from the state. But there are certain states that have answers for that. And if you lose SSI because more money, it really depends on how much more money that is. Sometimes the state lets you keep Medicaid. So I would definitely reach out to the state if that's your concern. And if your daughter's, disabled, receiving disabled adult children benefits, and then after a couple of years, they'll also receive Medicare. And if they get Medicare and Medicaid at the time, then reach out to Thomas and get set up with a Medicare Advantage dual eligible plan. Do you see any, what type of issues do you see with those dual eligible plans?
Yeah, dual eligible plans, it's a really good one. So one thing that we see with dual eligible plans often is that those plans often comes with transportation benefits, which are great. They actually help you get to and from doctor's visits, facilities, other things that you need to see. Oftentimes, those dual eligibles are really, really excited and frankly need those benefits. However, it can be difficult to actually get those appointments set up. Oftentimes there's waiting periods. There's a whole bunch of hoops that you have to jump through in order to take advantage of those transportation benefits. So understanding what's required and the timeline is really important.
Yeah, sometimes they're limited in terms of mileage, 50 miles or 25 miles or something like that.
Yeah, mileage, they'll limit you on the number of to and from trips that you can take. That can be part of it. If you live in a rural area, there can be some additional restrictions as well. So again, understanding how that benefit works and if it's actually going to serve your need is really important.
Perfect. Yeah, it's always in the details. Yeah, and
Yeah.
is it amazes me. Well, it does amaze me. I've kind of resigned to the fact that Social Security and everything, 20,000 pages of policy is just too difficult for people that spent their lives doing their job.
Mhm.
Those people know their job, and now they have to
Mhm.
spend months trying to figure out whether they're getting all their Social Security or Medicare and Medicare Advantage and Part D benefits, and it's just way too way too overwhelming and confusing. So
Yeah, it's not easy.
yeah, so that's why we put together the dream team, right?
Yeah, exactly. That's right.
Right. Oh, in the previous, let me finish the previous viewer's question about why do we have to pay the $174. I like to throw this out on a regular basis, particularly we're talking about dual advantage, the dual eligible plans. If you or someone are having difficulty paying that monthly premium for Part B, remember
Mhm.
the Medicare Savings Program. You can contact your state social services. And before I worked for Social Security, I worked for the Department of Social Services doing Medicaid and everything. You contact them and you apply for Medicaid. And if they put you at one of the higher levels, QI or QMB or something, then they will pay for your Part B premium. Another way to save yourself that money are Medicare Advantage Part B give back plans. And reach out to Thomas, and him and his team can see if there's one available in your area. And those Part B give back plans pay for part of your Part B, $25, $50, $100, all of it. But cautionary tale on that is if you're young and you're, young 65, 66, 70s, that's still young nowadays, and you're healthy, then those are good options. But, again, these insurance companies are, in it for a profit. And if they give you $150 a month and pay for, $150 for your Part B, they're going to want it out of some other place. So it might be more for a doctor, it might be more for a night in a hospital. So you have to kind of gauge those things. And remember, it's like you're 65 and you're going to be healthy next year. Yeah, get one of those Part B give backs, save yourself $1,000 or $2,000, take a nice little vacation. And then the following year, if you're so healthy, keep it, find a better one. Or, if it looks like you're going to not be healthy, then switch to something that has actually more medical coverage. All right, let's see. If you have insurance from work, still working over 65, do you have to have Part D? That was a big issue this year, right? That the government kind of did a 180, or as they used to say
Yeah.
in the old days, 360 degrees, but and that brings you back anyway. But anyway, so they said, all these private plans through your company are no longer credible because we changed Part D to limit it to $2,000. So if your company doesn't limit your prescriptions to $2,000, it's not credible. So you have to get Part D. And then they said what?
They said, maybe not. There was yeah. So there was a little bit, and I forget the exact wording, Ed. Maybe you remember what they did, but it essentially just said, you know what? Actually, we need to
Never
make some
mind.
adjustments here.
Yeah,
Yeah.
I think it was never mind. Yeah. So they just
Yeah.
kind of kicked the can down the road a little bit. And so no, if you're and this goes with Part B, and you have to sign up for Part B and Part D at the same time if that's what you have to do based on not having health insurance from work. So if you have health insurance from work and it's your plan has 20 or more employees and you're happy with it, and your employer doesn't, some companies make you sign up for Part B because they're trying to save money and stuff. But if those don't apply to you, then you do not have to sign up for Part B. You do not have to sign up for Part D, and you just go on with your life. And then once you stop working in the future, then about a month or two before you're going to lose your plan, then you sign up for Part B and Part D and all the rest of it. All right, here we go. Here's one for you. I went for glasses and they want me to pay over what is allotted.
Mm. Yeah. So whenever you are looking at the benefits associated with your plan, dental, vision, hearing, whatever it is, in this case, those vision benefits, there will be a maximum amount that plan will cover for, and then you could be responsible for the remaining benefit. You want to pay pretty close attention before you see any services, what is covered within your plan. And it's a good thing to go in prepared to have the conversation with your doctor to talk about what's allowed, what's permitted, and what they're suggesting, and what the cost could be to you. Oftentimes, a doctor will provide you with something that's called a good faith estimate. It helps you understand what your costs might look like given their recommendations. So that can be incredibly helpful to do as well if you're preparing to go see a doctor to see a doctor for anything and everything. Oh gosh, did we lose Ed? Maybe we did. We will hope that he is back in just a moment or two. In the meantime, let me see if I can answer some of these. Oh, Ed, you're
There we
back.
go. Yeah, I think we
I
lost it.
was
I think
Oh, that's
somebody's
okay,
on the
that
internet.
happens.
I think everybody's on the internet
No
checking
worries.
the election results, and it shut down
Probably.
everything. So, all right,
No
okay.
worries.
So let's see here. How do you qualify for free Medicare A and B? What does D cost? You qualify for free Medicare Part A if you paid, just like Social Security, you paid the 10 years, 40 quarters. Part B is not free. It's the $174.70, but everybody has to pay Part B, but sometimes another organization pays for your Part B for you. That is, the state through Medicaid or a Medicare Advantage. D really depends on your particular neck of the woods, right?
Yeah. Yeah, absolutely. There's a lot of factors that go into what your costs will be for your Part D plan. So important to talk to someone who can take you through all of your needs, think about where you live, all those good things, and give you an accurate estimate.
Perfect, perfect. All right, where do you find the chapter website to join? Just call Thomas and his team, the phone number right there, and they'll be able to help you out. Make sure you said Ed said hi, and they'll take
Yeah.
care of you, and they'll assign you the dream team,
Yeah.
the three amigos, the three musketeers.
Even if you
Let's
wanted to call right after this, they're here, they're there to help. Yeah,
Yeah, I think Thomas as a team and everybody are doing 7 days a week until, because
they
you
sure
have
are.
to switch for 2025 plans. December 7th is the final
Mhm.
day. So if you don't get in, and Thomas has already warned me that the final 10 days is going to be, uh, yeah, crazy.
Yeah, it is going to be crazy. There's a couple of things. One is that Thanksgiving is a little bit later this year, so that plays into it. But definitely, if you can call sooner rather than later, this is not something that you want to wait on because, frankly, like you're going to have some questions, and it's important to get those answered and not feel rushed to make a decision.
Exactly, exactly. As I always call Valentine's, the annual meeting of the Procrastinators Club, where all the
Yeah.
guys meet at Walgreens to find a card and some flowers, and so yes.
Yeah.
So let's not do that.
Yeah.
Um, Someone wants to know if Aetna HMO is right for me, considering that. As I always say, this is my regular spiel on that. That might be a great plan in one particular part of the country for your next door neighbor, but
Mhm.
maybe in your particular part of the country, that's not a great plan. It really depends on because there's hundreds of versions of that particular plan throughout the country. Some of them are great, some of them aren't as great in that particular area. So it really depends on your particular situation, whether it covers your doctors, covers your prescriptions, and all the rest of it.
Yeah. One thing that we do see very often is people come in with an idea of what provider they are excited about, and that's awesome. You should share that information with who you talk to, but keep in mind, and just like you said, just because a provider might be good for someone you know doesn't necessarily mean it's the best option for you. So it's good to go in with an open mind before choosing.
Exactly, exactly. Same thing, with picking a Medicare plan. You might be great for your neighbor. Same thing with filing for Social Security. You might have been great. Oh, you should. I've so many social media people out there. Oh, 62, you have to file at 62, or you're going to be throwing money away. But it's not for everybody. So if you're working and you've got other situations, then might be 65, 67. So it really depends on your particular situation. Let's see. I spoke to Milo a few weeks ago, and he was great. I won't be 65 until April, so we will reconvene. Question: I live in Tucson. Will I have as many Medicare Advantage choices as other cities have? Tucson's a pretty big city, so probably they're going to be more. If we're talking about Arizona, it's going to be more probably in Phoenix than Tucson. Um, yeah, less
Yeah.
in
I
Sedona.
Yeah, I would agree with that. But as someone who lived in Arizona, Tucson, what a wonderful place. You know, there's lots of options to go over, so it's important to, yeah, talk to an expert.
Yes. All right. How long did you live in Tucson?
I didn't live in Tucson. I lived in Phoenix, but I took a couple of day trips, and I frankly I think
Yes.
I'd rather have lived in Tucson. There's some great
Yes.
food down there.
Yes. I lived in Mesa, Arizona for a few years.
Oh,
Yeah.
yeah,
But there's,
right.
yeah, one of the best pizza places in the country is right there in Phoenix. Go figure. Yeah. So anyway.
So many of them. Actually, a couple, yeah.
Yeah. Yeah. All right. Yeah. We're getting off track here. Will there be any zero cost plan D options by the time I get on Medicare in April? Well, yeah, if you're talking about April, then those plans are already out.
Yeah.
So I think there are some zero plan. There were a lot of zero plan Part D plans for this year for 2024, but because of the changes, the 8,000 to $2,000 max and everything like that, most of those have disappeared. But I think there are still some zeros out there, aren't there?
Yeah, there are some, and again, just to reiterate, those plans are already out today, so even if you wanted to just start exploring, you can, early, just, think about the timeline and what you actually apply.
Perfect. And this is what a lot of people that get Medicare supplement plans, they sign up for Medicare supplement, a plan G and whatever the case may be, and then the person, whoever's helping them sign up says, okay, let's find you a prescription drug plan, and then you say, hey, I don't take prescription drugs, I don't want one of those, and then the person that helps you out does you a disservice by saying, okay, fine, bye, because they don't really make any money on Part D. And a year, 2 years, 10 years later, when you start taking prescriptions, then you're going to be penalized 1% for every month you did
Mhm.
not have it. So, and that's the perfect time to look for a zero premium plan because you're like, I don't really need it, but I don't want to get penalized.
Yeah,
So let me find the cheapest one possible.
yeah, that's right.
But again, it's a kind of a loss leader with those zero premium because if you take prescriptions, you might actually pay more with a zero premium than with one that costs 30 or $40. And why is that?
Yeah, absolutely. Actually, so this is a conversation that I was having with my dad not that long ago. My dad is a pharmacist. He's very well versed
Ah,
in the world of insurance and Medicare. And he actually spoke with one of our chapter Part D advisors not that long ago. It's really, really important to think about what your specific needs are. My dad and my mom have two very different experiences when it comes to their Part D needs. It would not make any sense for them to be on the same plan. A lot of that is because of the types of prescriptions that my dad takes. It actually makes more sense for him to pay the cost of a premium because he ends up in the long run of the year spending less money on his prescriptions, even with that monthly premium.
yeah. Yeah. So it really depends on the deductibles and the tiers. And yeah, so sometimes it does pay to pay a premium. So yeah, it really depends on your particular situation.
Yeah, you want to think about the
Uh,
whole year, not just the premium.
Exactly, exactly. I hear Florida has the most options. I guess the market size differs due to population. Yeah, there's a few retirees in Florida. Yeah. So, yeah, Florida has some of the least expensive in terms of Medicare Advantage. What there's some out there I've seen six, seven, $800 max out of pocket in Florida. But I also see a lot of doctors. I'm getting a lot of reports of doctors not accepting particular Medicare Advantage plans in
Yeah.
Florida. So if someone calls you and says they're not, my local hospital is not taking this plan anymore, my local doctor is not taking this plan anymore. Um, can they change plans, or do they just have to look for another hospital, another doctor?
Really depends. Really depends on a few different factors, including, time of year, if there's a way that they can become eligible to take advantage of and change their plan. I will say there are many different scenarios in which you actually might be able to change your plan. So if you aren't sure, it always makes sense just to ask an expert and see if there's anything that they can do. I think one of the things that always impresses me about chapter is the way that we keep up to date on, the very many things that can impact if someone can change at any given point in time. So depends, but talk to an expert.
Perfect, perfect. And we're at an hour, so we'll have this as our last question. What information do I need to have when I call chapter?
Really great question. Um, Bring yourself. That is the most important thing. And if you want to be really prepared, it can be helpful to have a list of your doctors and your prescriptions handy, because that is information that's really important to making a good decision. So that is something that you want to have handy. But I will say, don't delay the conversation, right? It's better to get on the phone, start the conversation with the information that you have. And if there's anything missing, let the person know, I'm not quite sure about this, or I'm not quite sure about that. They can help you figure out the details.
Right. Yeah. Because if you wait till the final 10 days, then,
Yeah.
Thomas and his team are going to be really, really backed up. And, one thing leads to another. And because it's already November of 2024,
Hmm.
time flies when you're having fun, right?
Yeah, sure is.
All right. All right. We'll call it a day today. I sure appreciate it, Alyssa. Hopefully, we'll have you back again in the future so we can help more people out getting everything they're entitled to, and we'll keep a roll on our dream team.
Yeah, sounds great.